Hey everyone, how's everyone today? Oh, it's the second day. I guess spring was yesterday. Not a time for us, but I know everybody else is enjoying it. Springtime is such a good time of year, right? We're starting to get a little bit of good weather, which is perfect. And so we'll see how it goes, right? What's going on with my hair here? I don't know. Anyways, it's March 21st, 2023. And this is Tuesday, Tea at 3. Thank you for joining us. Hi, Janice. How are you? I appreciate you joining us all the time, every time it comes up. Hi, Kathleen. I appreciate you joining us. It's great to have when you're sitting here talking, you're just a talking head, right? Hi, Nicola. And so it's nice to have you guys join me because then I feel like I'm talking to somebody, and I know you always appreciate whatever I have to say. So we all have COPD. Most of us have emphysema. Some of us have other reasons for having COPD, like, hi, Beverly, how are you? Nice to have you join us. It must be very early morning for you, because I think you usually get me when you're a little bit later in the day. But I enjoy you. I enjoy having you here. I was just saying because I feel like I'm talking to somebody then, right? And I know everybody's there. Yep. It's 8 a.m. for you, is it, Beverly? Hi, Beverly Seltz. How are you? Nice to have you join us today. So today I wanted to talk about our pulse oximeter. I think that we probably all have one. It's funny, I never knew about this until I was diagnosed with COPD and had my first exacerbation. And my daughter and I wanted to buy one. And so we went to the drugstore to find out how much they were. And they were about $120, about $120 Canadian. So a little bit more American, a little bit less, I guess, American. And I have no idea, Beverly, what it would be in your monetary value, but that was a lot of money. And we decided to pass on it. And it was very shortly after that they started to become very effectively priced. And so now I have two of them. I wouldn't be without one. And it's how I measure how well I'm doing today. Hi, Jane. Nice of you to join us today. So today I wanted to talk to you about your measurement of O2. This talks about the oxygen that's in your blood, and it's not the only way of measuring the oxygen in your blood. The way we find out if what we're monitoring here is true is by doing an arterial gas test, which most of us have had at least once or twice, and nobody enjoys. It is a fairly painful test, but it tells this real story about how much oxygen is in the blood. And when you have emphysema like I do, those numbers are vitally important. Once the arterial blood gas is done, and it's done by a special nurse, it's not everybody can just do it. And some people can do it and do it very effectively. For others, it's very, very painful. So this is a measurement of checking your vital signs. And our vital signs consist of blood pressure, temperature, pulse, and respiratory rate. We need to add to that our O2 levels because this gives us a thorough understanding of what is happening to our body and what is wrong and what is right. The problem is even though checking vital signs is cheap and important, not enough value is given to the way that it is done. And I've had lots of nurses and doctors who have just kind of poo-pooed it and said, oh, you know, you're fine, don't worry about that. It's not accurately recorded, and it's not acted upon properly. For those of us with COPD, we know what this means when our when our oxygen saturations are low. And we know that this is often an indicator of infection or something else that's going on in our lungs that is not accurately measured. It presents a problem when OS2 stats are not regulated properly, as there is there's little training in the field of taking vital signs. Have you noticed this when you're in the hospital and you'll get some pompous doctor who just says, oh, you know, that's fine, don't worry about it. We don't really pay too much attention to that. And to that I answer, well, you should be. Because I check my blood oxygen saturations several times a day so that I can find out if what I am checking and where the normal level is. And if you're just going to poo-poo that information, that's not good for me. So we have to be careful that we're taking these doctors to task. I mean, I don't mean to complain about doctors. They're wonderful people, and you know, they can and do save your life. But listen to me when I tell you, I have met some of the most pompous doctors who have, you know, just assumed that I didn't know what I was talking about, when I kind of do, because it, you know, has something to do with me. And they are ill-trained in the field. So I would say proceed with caution when a doctor is telling you that the information that they're getting is not important. Also, I was reading this I was doing my research yesterday, and I came across this on this was Instagram, I believe, and I'm going to tell you who it was from. Just have to go all the way to the top there because I was looking for something to post, and I was going way to the bottom. So this says, and this is by Respiratory Therapy Facts. Now, I don't know who these people are. I have no idea who these people are. Did you know that a study in 2020 by the University of Michigan showed pulse oximeters read higher than what was accurate in 11.7% of Black patients compared to 3.6% of white patients? Why is this important? Well, of course it's important. It's important because we need to know if what we are getting is the accurate information. The pulse oximeter readings were compared to patients' ABGs, which is arterial blood gases, which I was talking about before. This means that Black patients are more likely to have prolonged medical intervention and not receive the correct amount of information. The FDA is now investigating this issue. So once again, we know that it is super important to look at racial disparities. We know that when we do a when we put an oximeter on, we cannot use nail polish. We have to take our nail polish off. We also have to make sure that we don't have any henna or anything else that can impede it. And so what happens when we do the oximeter is that the light flashes down and the reading is down here. So does it make sense to you that if this is the way that the pulse oximeter is reading and it's taking it from down here, that the color of your skin would matter? Now, that's not to say that there's anything wrong with the pulse oximeter. It just means that it was made for a white person, like most things in this world, right? And if your skin color is dark, you need to manage this better with your doctor. You need to make him aware that this can happen. And this says that the University of Michigan, so I'm not exactly sure. I didn't investigate further after that. I just thought that that was an interesting point. In order to use a pulse oximeter, you have to remove all of the color from your hand. So you have to take off all your nail polish. It won't read the same with nail polish on, even if it's clear nail polish. You have to have your hands warm. So you might find that when you're out and about and your hands get cold, your oximeter won't work. You know, it sits there and it just flashes and flashes and flashes. So warm your hands. Rest for 5 minutes. So what happens to me is I get up and I go to the bathroom and I'm gasping for air, and I check my oximeter and I'm down to about 80. And this scares the daylights out of me. If we are talking about resting for 5 minutes and then taking it, I will have recovered within the 5 minutes. Not always, though. Sometimes it takes a little bit longer than that. It works best on your middle finger. I'm not sure why, but they say that this finger is connected to the heart. And it works best on your left hand. Who knows if that's right? The only way that we're going to know if that is right is if we test it a couple of times, right? We have to wait for the results to stop changing. And you know, when you first put it on, that it starts flashing. That's the first thing that happens, right? It starts flashing, and then you turn it on and the numbers start going up and down. What you will find is that the top number, which is the SpO2, is your oxygen rate, how much blood or how much oxygen you have in your blood. And the lower one is the pulse rate. That is your heartbeat. So we have to wait for the steps for the oximeter to stop, wait for the results to stop changing. Identify which is the oxygen and which is the heart rate, because you can change that. You can change that by touching this. This will change from the heart, from the oxygen being on top to the oxygen being on the bottom. So you have to make sure that that you have the right one. What you will notice is that when your oxygen is low, your heart rate is high. As your oxygen comes up to a lower level, to a proper level, your heart rate will come down to normal level. And that happens all the time. You should be checking your oximeter several times a day. Mine, I've got one in every room now because they're so cheap now. I have one in every room. So you can check your vitals several times a day and write it down in a kind of a grid form, in a journal. This way you have evidence-based information about what your vitals are on a normal day. Has your doctor told you what a normal oxygen level is? If you have emphysema, your oxygen must stay between 88 and 92. Now, we know with exertion and that sort of thing that your oxygen drops, and we have to get into a position of recovery and all of that stuff. But some people are under the impression that if they can get more oxygen into their lungs by maybe turning that oxygen up, that they're doing better. It's not true. And what happens when you turn the oxygen up and you get too much oxygen in your lungs, you end up with carbon dioxide poisoning. Your oxygen must be maintained between 88 and 92. Now, I find that my oxygen or my breathing is best at 93. Might not be the same for you. Only you can decide what your normal oxygen will be. And how do we know that? I know that because I monitor it all the time. 88 is just a little bit low for me. I feel like I'm kind of struggling to get air in. 93 is perfect for me. But I will never go much higher than that without either taking my oxygen off or reducing the oxygen flow. Be careful about this, because if your oxygen saturations are too high, you can end up with carbon dioxide poisoning, and that can kill you, right? People die from that. So you have to be really, really careful. That's when your oxygen is too high. Now, if your oxygen's too low, that's not good either. And although we go low with exertion, when you get up to go to the bathroom or whatever, we want to make sure that it comes right back up. And once again, you have to monitor how long that will take. So perform vital signs 3 times a day. Record your results so that you have an understanding of what's going on with your oxygen saturations. This is Barbara Moore for Catch Your Breath 60, and I appreciate everybody who came to see me today. Thank you.